Schizophrenia by Jeremy Tarrant. Diagnostic criteria for schizophrenia: delusions, hallucinations, disorganized speech, catatonic or grossly disorganized behavior, negative symptoms. To be considered true schizophrenia, 2 or more of the above symptoms must occur frequently in a 1-month period. At least one of the symptoms must be delusions, hallucinations, or disorganized speech. This order must occur over a 6-month period. Delusions and hallucinations. Delusions are obviously improbable and incognizable to someone with the same cultural perspective. These are fixed beliefs that are not easily changed even when the individual is presented with evidence that refutes them. Hallucinations. These are indistinguishable from an actual sensory experience but occur in the absence of external stimuli. Can occur in any sense, but auditory is the most common. Sensorium must be clear. Hypnopompic or hypnagogic hallucinations are considered normal. Disorganized thinking and grossly disorganized and abnormal motor behavior. Disorganized thinking is deduced from the individual's speech. Speech becomes derailed or there are loose or illogical associations. Individual may switch rapidly from unrelated topics or derailment. Grossly disorganized or abnormal motor behavior. It can be as simple as silliness. They may have unpredictable agitation, motor response with no observed external cause. Catatonic behavior or serious decrease in reaction to the outside world. Bizarre or rigid posture, or both may occur simultaneously. And excited motor behavior without purpose. Negative symptoms. These are defined as avolition, a lessening of motivated, purposeful, self-initiated activities. Alogia, reduction in patient's described ability to experience pleasure or recall previous pleasure. Asociality, disparity of interest in social interaction. The patient may have limited opportunities for social interactions due to the effects of other symptomology or their treatment regimen or other causes. They may have diminished emotional expression, reduced reactions to the expression of emotion in the face, lack of eye contact, or prosody. Catatonia has been historically associated with schizophrenia. This may not always be the case, and it can be caused by other disorders. The neurobiology of schizophrenia. The neurotransmitters that are involved are dopamine, glutamate, and GABA. Serotonin does not appear to play a role in schizophrenia. Serotonin antagonism at the 5-HT2 receptor site does improve the neurological side effects of antipsychotic treatment, however. Dopamine is released by the basal ganglia. First generation antipsychotics were developed from antihistamines. They all block the dopamine D2 receptor. These are phenothiazines. Chlorphazine, thorazine is the most famous of these. These drugs unfortunately were developed at a time when side effects were viewed as necessary for a drug's efficacy. They tend to produce side effects similar to Parkinson's. Second generation antipsychotic. These tend to have fewer side effects, though they can include tardive dyskinesia, hypertension, overeating, and, with clozapine, agranulocytosis. Schizophrenia tends to be chronic. Symptoms typically do not improve without treatment. Rates of suicide are roughly 20% that attempt it, and 5 to 6% are fatal.